this video, I would present a technique of all inside box stitches to repair a lateral meniscus bucket handle tear at the periphery due to a discoid lateral meniscus. Anterior half of the meniscus was repaired with inside out technique. On the scans, one can appreciate the discontinuity of the menisco-capsular junction along with the discoid tissue medial to the discontinued margin. This made us suspicious that there could be an inherent tear. On diagnostic scopy, we could see a discoid meniscus with an flipped inferior fragment, and on peripheral probing, this meniscus was pretty loose and was coming easily into the joint. On shifting the scope laterally, one could see a clear-cut tear present between the peripheral capsular rib and the discoid tissue. Central menisectomy was done with an artery forceps in situ to prevent bringing the peripheral tissue into the bite, and also it allowed us to remove the inferior bucket handle fragment which was not amenable for menisectomy without stabilizing the meniscus. The peripheral menisco-capsular junction was prepared using a shaver without suction to avoid any aggressive resection of the remaining meniscal tissue. The posterior half of the meniscus is repaired with a scorpion device with box stitches. It is important to note that the bites are taken from going below the central fragment, going right up to the peripheral margin, and so it makes easier to retrieve the suture because they are coming from the top. If the bite is taken with the scorpion device from above the central fragment, then the suture is not visible and it is very difficult to retrieve. This suture is parked outside and the second bite is taken onto the central fragment. Another technical tip is not to tie the sutures first. Take all the bites and then subsequently the sutures can be tied one by one. Here, after the bite, the sutures are parked outside into a separate portal and then proceeded with the second bite, which is much more lateral to the first one. In a similar fashion, the bite is taken from going below the central fragment, coming out to the periphery, visualizing the bite, the needle coming out, and while taking the bite on the central fragment, one is made sure that you rotate the scorpion device mediolaterally so the needle doesn't go and hit the cartilage, because it might lead to cartilage damage or needle breakage into the joint. While inserting the scorpion below the central fragment, one might not be able to put it directly, so we need to invert it and then again rotate it back upwards once we reach the peripheral margin. Once the bites are completed, the knots are tied from medial to lateral. Here one should be mindful that these are 0 number fiber wires and one should be very careful while tying the knots not to overstretch it, otherwise it might just break or the meniscus might just cut through due to cheese wire effect. Once the satisfactory reduction of posterior fragment is noted, the repair in front of the popliteus can be done via simple inside out or outside down stitches. Here we decided to use an inside out device for the same. 2 bites on the top and 1 below was enough to reduce this small anterior tear. Post repair, the reduction was satisfactory, the normal contour of the meniscus was restored and the margins were stable. Thank you for watching the video.